Lucy, I'm going to be your nurse today. We're going to do a postpartum assessment on you. So first I'm going to do your blood pressure, heart rate, respiratory rate, oral temperature, and I'm going to assess, are you in any pain? No? Okay, perfect. So now while you're here, I'm going to be listening to your heart sounds and your lungs, your bowel sounds, back of your lungs, and check for CVA tenderness. Okay. Good. Clear lung sounds. Good. Oh. Normal bowel sounds, they're not hypoactive from any pain medication, anything you're taking. Are you pooping? I know you're pooping. Does that hurt? Does that hurt? I think I did that before. No, I think I did it. Either way, I just want to make sure that your kidneys are fine. Okay. I'm going to skip around. I'm going to ask, do you have control of your bladder and your bowel movements? Like, I just want to make sure that, you know, like if you had a C-section or an epidural, that you're using the bathroom and that you have control of your sphincters again. Okay, let me check your breast. See that they're firm, that there's no redness. Make sure your nipples aren't cracked. Okay, and then I'm gonna check your uterus. So I'm gonna hold right there, and then I'm gonna make sure that, just see if it's soft, it's firm. Check what's going on, measure fundus. And while your legs are spread, I'm gonna look at the lochia, make sure there's no clots, look at the consistency, the odor, and the color. Just make sure I'm right on track here. Okay, and then I could look from behind and check if she has any hemorrhoids, check her epistomy, and use Rita, see if there's any redness, ecchymiosis, and edema, and see where it's located, acceleration. So then I'm gonna look at her skin. She's got striae. She has a linea nigra. Girlfriend has no stretch marks. And were you sweating? I see a little bit of sweat on you. It was a hard labor. And how do you feel right now? See, all eyes on baby, crying with tears of joy. You're tired, that's normal. But you might be a little tired for a while, so activity-wise, you wanna make sure that you're taking it easy when you get home. Make sure that you don't push yourself too hard, but other than that, you really can return to normal. Just wanna make sure you don't lift anything too heavy. You and baby should rest up. But if you find yourself in the next few weeks feeling really sad, feeling like you can't take care of you or baby, you should go see your doctor, because that might be signs of postpartum depression. All right, does that sound good? Do you have any concerns? Before I leave here, I'm gonna check out your legs, okay? So I'm just gonna check for your deep tendon reflex. Here's your little kneecap, and then I would take my hammer and pop. Okay, cool. I want to make sure that you respond. Then I'm going to check for clonus. I'm going to take your feet, go back. Okay. It didn't jerk, so that's good. And no edema. And your calves don't feel tender, so that's good. All right. So that's about it. Let me know if you need anything. I'll leave the call light on. Enjoy time with baby. Thank you for being my patient, Lucy. It's been